Over the last 12 months, nearly 6 million more Americans lost their health coverage. That's 17,000 men and women every single day. We're not just talking about Americans in poverty either. We're talking about middle-class Americans. In other words, it can happen to anyone. And based on a brand new report from the Treasury Department, we can expect that about half of all Americans under 65 will lose their health coverage at some point over the next 10 years. If you're under the age of 21 today, chances are more than half that you'll find yourself uninsured at some point in that time. And more than 1/3 of Americans will go without coverage for longer than 1 year. I refuse to allow that future to happen. In the United States of America, no one should have to worry that they'll go without health insurance. Not for 1 year, not for 1 month, not for 1 day. And once I sign my health reform plan into law, they won't. My plan will provide more security and stability to those who have health insurance, offer quality, affordable choices to those who currently don't, and bring healthcare costs for our families, our businesses, and our government under control. First of all, if you are among the hundreds of millions of Americans who already have insurance through your job or Medicare or Medicaid or the VA, nothing in my plan will require you or your employer to change the coverage or the doctor you have. What my plan will do is make the insurance you have work better for you. We'll make it illegal for insurance companies to deny you coverage because of a pre-existing condition, or drop your coverage when you get sick, or water it down when you need it the most. They'll no longer be able to place some arbitrary cap on the amount of coverage you can receive in a given year or over a lifetime, and we will place a limit on how much you can be charged for out-of-pocket expenses, because no one should go broke just because they get sick. Second, if you're one of the more than 30 million Americans who can't get coverage, you'll finally have quality, affordable choices. If you lose your job, change your job, or start your own business, you will be able to get coverage. And as I've said over and over again, I will not sign a plan that adds 1 dime to our deficits, period. This plan will be paid for. The middle class will realize greater security, not higher taxes. And if we can successfully slow the growth of healthcare costs by just 0.1% each year, it will actually reduce the deficit by $4 trillion over the long term.